Hi everybody, Dr. Laurie Perrin here from Slow and Steady 360, and I'm here today to talk to you about how to start intermittent fasting. Because we know the benefits of fasting start anytime after the 12-hour mark, I suggest that you use this 12-hour mark as a good place to start. For 1 week, I suggest that you start with a 12-12 split. Example, you eat from 8 a.m. to 8 p.m., and you do not eat from 8 p.m. to 8 a.m. After the first week, if that felt okay, go ahead and eat 1 hour later for the next week. For example, start eating at 9 a.m. and then stop eating at 8 p.m. For the following week, try to start eating at 10 a.m. and stop eating maybe at 7 p.m. One thing that many people comment on is that they find that they're not even all that hungry in the morning. That makes a ton of sense because when you wake up in the morning, your cortisol levels are really high. And cortisol's job is to dump glucose from your liver into your bloodstream so that you can get up and go. And guess what? When your cortisol levels are high and it's dumping glucose into your bloodstream, you do not feel hungry. So not eating in the morning often feels very natural for many people. One question I get asked a lot is, can I drink during my fasting period? The answer is yes. Please do. You can drink water, tea, or coffee. Really anything without calories. You can drink water with cucumber slices or orange slices in it. You can drink tea, green, black, herbal, and you can drink coffee. The point is that you're not adding a ton of sugar, milk, or cream into these substances. Many people work towards a 16-8 split, where they eat from, say, 11 a.m. to 7 p.m. or 1 p.m. to 9 p.m., depending on what works for their schedule. Once you're comfortable with the timing, you can decide how you want to practice IF and incorporate it into your life. Are you somebody who it just works to try to do it every day, or would it work for you to take weekends off, especially at first? This is what we tried, and I have to be honest, within a few months, we just kept doing it on the weekends because it felt so natural. Flexibility is one of the reasons why intermittent fasting is so easy to adopt as a new normal. Like I mentioned earlier, you can decide if you want to continue to do it on the weekends or take those off. Or if you have a certain event on a certain night, you can shift your eating window so that it accommodates plans that you have that are out of the ordinary. The benefits of intermittent fasting are so important that we want to make sure we keep sight of them. What are they? Well, first and foremost, weight loss, especially in your central region and on the average of 1 pound a week. With intermittent fasting, you'll notice a clearer mind and clearer thoughts. It works to lower blood pressure, cholesterol, and your triglycerides. Promotes autophagy, which is your body getting rid of old damaged cells and allowing for regrowth of new cells, as well as decreases inflammation. Now, after hearing all of this, don't you want to give intermittent fasting a try? I really think you should. Your health and your well-being may depend on it. You should try and start it now. There's no time like the present. If you have any questions, Slow and Steady 360 is here to help you be successful. You can email us at slowsteady360@gmail.com or sign up for our free newsletter on Instagram in the bio. I hope you enjoyed today's presentation about how to start intermittent fasting and that it's given you some ideas and tips on how you can try intermittent fasting on your own and see what you think of it. Have a wonderful day. See you next time. Bye.